in the county and to kind of get set up for what we got going on in next week's monthly meeting. Do you know where cases are right now, Sean? Are we at 8?
That's my understanding.
I think it's 11.
Is it up?
Yeah, we just got 2 results back this morning positive
Okay.
that I
So,
tried to call Teresa. She was off today, so
yep.
yeah.
And so I don't know if anyone's coming off of,
I don't know that.
so
Yeah, I don't know that
But-
either.
it sounds like we're probably maintaining at a minimum where we're at.
So is Billings Clinic, are you admitting COVID patients?
No.
What
We
are you
are
doing with them?
We are shipping them either to St. Pete's or Bozeman because we've got the long-term care in our facility and we are guarding them with our lives. You know, if we get someone coming to the ER that's potentially positive, we have the reverse isolation room we put them in. If we have to keep them overnight too, observe them and wait till we get the test results back, because sometimes St. Pete's won't take them. And once we get the results, if they're positive, they're gone.
Okay.
So at this point, that's where it's at. Unless Bozeman and St. Pete's get full, then we're going to have to look at keeping them. And we do have that one reverse isolation room which we can keep them in. So
So basically you have the potential for one person.
yeah.
I know that we have one hospitalization, according to Teresa, one person that tested
Yeah, I don't
positive here.
I don't know about that.
I don't know where.
We did send one to Helena a couple days ago.
Yeah.
Our ambulance went to the house, picked him up, and took him to Helena. So,
So,
yeah.
Has anybody talked to the school? What kind of situation do they have anything going on there as far as active cases or anything that we know of?
I know they have the one from last week, but we tested quite a few of the students that were in contact, and they all came negative. We did test a bunch of kiddos yesterday. 2 of the 3 came back, and they were negative, but that was a familial type thing. A family member had tested positive, so.
So I guess, are we, what are we doing with trick or treat and ghost stroll? That stuff's all on to go as is now, or?
well, we haven't told them any different at this point.
Okay.
The ghost stroll. I think the ghost stroll, when we went through it, I felt like we considered, or at least we were thinking that if we were going to be kind of here or similar. I mean, they're doing it outside. Even if it's cold, they changed their plan to indicate that no matter what, it would be done outside. And so I think there's something good about that part
Right.
of it.
Mhm.
And then, it's all prepackaged, and hand sanitizer and that are supposed to be available at each one of the, where they're giving candy out.
Mhm.
And they're supposed to keep them moving on, so. But, we've always told every group that things could change
Right.
if
Right.
things got worse. We just kind of have to decide if this is, are we at that worse location now, or what is that threshold, I guess? Is there much difference between 4 and 8, or 3 and 8? I don't know. Do you have any thoughts on that, Dr. Campbell?
Not really.
I mean, we're already getting requests for the Christmas roll
Mm-hmm.
and that, and for me, it's hard to even think that way when
Right.
we're seeing that curve go up. I just don't even want to have to think about it. I mean,
Right.
obviously, I want to put my head in the sand and just say no.
Yeah,
Can't do
but
it.
yeah, that's yeah.
But the community wants to know if they can do that, and they need to start planning something like that now.
Right.
And so they are planning on getting me a plan, so I can forward it to you
Mhm.
in the near, probably, I was expecting it this week, so we could still get it. Because I think they were hoping we would be able to discuss it at the Board of Health meeting maybe not necessarily decide, but at least have the discussion, so.
Sure.
I might ask them to do that.
Mhm.
I thought the regulation was extended caution over 4.
4 or more, right?
Yeah.
Yeah. Yeah, and for the, like the, Christmas stroll events, we have been doing is what the Board of Health has been doing is any activity that's over 50 people, we have to submit a plan on how they're going to just maintain the social distancing and sanitation and that type of thing. And like the Christmas stroll would be one of those activities we'd want to make sure didn't turn into a free-for-all.
Mhm.
We haven't heard anything from Christmas stroll people at all about what they're planning. I mean, that's a month away.
No, so that's what I'm expecting,
Yeah.
to hear something. Why, when is it?
Isn't it the
First weekend
first
in
weekend in December? Yeah, I was thinking we had longer than that, but we really don't.
Yeah, but they'll, yeah.
Are you seeing any flu activity yet, Doc?
Oh, yeah. Couple. Any news this week over at the hospital?
No, not that I'm aware of.
What would we expect this time of year normally?
About that?
Yeah,
So
it
we're right
usually.
April,
Mhm.
I was hoping it would be less, what with everybody wearing masks and whatnot.
And hopefully they're getting their vaccines done early
Yeah.
too. But
I think that-
Y'all doing a lot over at the hospital, vaccines?
yeah, and I know health department's really busy too.
Yeah, they are.
We are limited on our high dose, so that kind of puts a kibosh on us. So county health has to take that right now. I don't know why we can't get it. It's on back order or something, but the regular dose we have plenty of.
Didn't Teresa say she was getting a shipment of high dose?
Yeah,
Yes.
she said she had them.
Yeah,
Yeah,
she does.
she has them.
Okay.
Yeah,
Yep.
so.
Okay.
So we are starting to get complaints. Obviously, people are aware that the county is now in a mask order.
Mhm.
And so we are starting to get complaints about establishments. And I reached out to Corey Swanson, the county attorney, so that we could start talking about what is the expectation in terms of enforcement. And there's kind of two legs of that when I think about it. One is the establishment itself has to follow
Mhm.
the regulations, meaning the owner and the owner's employees
Right.
need to be following it. And then there's the customers or the
Mhm.
clientele. And I feel like all we can do is try to educate the clients and customers. There's not much that we can do or expect the owners of businesses to get people to wear masks. Now like Cenex at one point early on when we were under the mask order, they weren't doing a good job, but I went in, he was making signs, better signage and
Mhm.
that. And then we've also handed out signs. So that's something that we can do to help the businesses try to educate the public about wearing masks and the requirement. However, there are establishments that are pushing back directly about whether they're going to have their employees or them as owners are going to wear masks. And to me, that's a much different enforcement issue. And that's something that I emailed back to Corey because he said when he responded back, he was only thinking of the clientele customer area. And the governor did today just give a speech about getting more resources for enforcement. I don't know what that means, and Corey said that he would try to have something for us for next week's meeting so that we know what that means. You know, as you can only imagine, that's not the approach that I want to go as an enforcement. And I would much rather be at the education and helpful side of going into establishments. But at some point when they push back, and just blatantly will not follow the directive, we're gonna need to have some protocol.
Let me ask you, are you also advising them that they can use a shield when appropriate?
Yeah,
And they don't wanna
plexiglass.
do that either?
So they are considering it, and I told them that right now, I don't know what the enforcement and compliance is, so I'm telling them they need to come up with a plan, and so I'm trying to work with that, yeah. Yes, I mean, that's the reality is,
Mhm.
let's try to come up with a solution that's feasible for what they're trying to do, so. But there are some establishments that just want to push back. You know, Dave Hansen down south is just anti-anything right now. But I'll be going down there at some point, and next, probably on Friday, to meet with him. Typically, if I can walk through the scenarios with them, most of the establishments have been pretty good, but if it's just going to be me counting to 3 every time and nothing happening, then that's not good either for what we're trying to accomplish and stuff.
How close do you think we are to going back to lockdown? Statewide, or, I mean, is that gonna be a decision that, is the state gonna make that decision, or are they gonna leave that to local health boards?
When I saw the governor speak last week, I heard him say, Flathead County doesn't want some guy in Helena telling them what to do. So I think I'm taking that until after the election, he's not going to.
Yeah. I know
Make
Billings
any
has done some shutdowns,
Yeah.
shutting down like restaurants and such, still doing the delivery and takeout and stuff. I saw that through Billings Clinic sent out a notice. So, you know, they're doing some on their own.
Yeah, I think his expectation is that the local
Mhm.
boards of health.
At least
the
at this
local,
point, yeah.
are to address the issue based on what their community wants or what it needs.
Yeah.
I know the Missoula Board of Health shut down the Montana Club and the Alcan Bar because they weren't complying with the guidelines at all.
Right.
Hmm.
They have their board of health is very well organized, and they have a health officer that, you know, is a full-time employee and that, so they're in a little
Yeah.
much different situation. Plus Missoula has always been a little more iron-fisted.
I don't think we're at that stage. I just-
No.
People need to pay attention. I mean, I think what happened is everybody got pretty complacent with it, and now it's, you know, here, now we went from 2 cases to 9, 11, 10 cases. We're 5 times over what we were before.
And we do think, I mean, after conversations, that we think there were some activities that have occurred that we think may push that, you know. We have another week, I guess, before we figure out what happened with the big event up in Helena, and then the kids that had come home from Dillon. I think we're probably almost through that window. But there's still a lot of activities
Mhm.
going on. And once it gets cold, all these activities that we've been doing outside,
Mm-hmm.
when do they move inside?
And I guess, you know, the best thing that we can do as far as the board or anything goes is try to keep people aware. That's all we can do. I mean, educate them as much as we can. What's gonna happen is gonna happen. I don't have any, does anybody else have anything else? If not, we have a meeting next Wednesday at 1, our regular meeting, so. Did we have the agenda out yet or not?
We have a
Yeah.
draft one sent
Yeah.
out.
Okay.
And if people need anything added to it, we can add to it at that time. or I mean now, and then
Okay,
it'll be posted on Friday.
okay,
I emailed it yesterday.
okay.
And I think that from my standpoint, I think we can probably do very similar to what we did at the very beginning of all this, which is just me spending a little time with the establishments and maybe handing out some new signs for them. I think we're all at the point where signs can be very simple. We don't need to have a bunch
Yeah.
of additional information on them, like are you feeling sick? I mean, I think that message has been out there, so
Mhm.
let's just get to the point where we're just saying masks are required, and I can get some of those laminated, hand them out, just use that as an opportunity to remind establishments of they're required to have masks on. And then if you think of anything else or hear of any places that need that. I typically focus on licensed establishments, meaning food service establishments and the grocery store and that type of thing, because they have licenses and that's who I'm used to dealing with. I don't go into like True Value or those, but I can.
Okay, I don't have anything else. Nobody else have anything? We'll call it a day. Everybody be safe. Take care of yourselves.
All right.